Hi. Now that we've talked about some key principles you can use for your recovery, we're going to talk about common factors amongst the treatments that work for borderline personality disorder. Whether you're working with a primary care provider or someone who prescribes medications or a psychotherapist, these common factors can be integrated into your treatment to optimize your outcomes. In general, psychotherapies work in a certain way. One way you can think about it is that when you have a psychological difficulty, that may relate to some sort of maladaptive folk psychology. What that means is that we all have stories we tell ourselves to explain what happens to us. So if you've had a lot of difficulty in life managing your moods, behaviors, and relationships, it's easy to end up with a story about yourself, that you're bad or broken, so only negative things will happen, or that the world is a dangerous place and only trouble will befall you no matter what you do. These maladaptive folk psychologies can really limit what you try to do in your life and make it hard for you to improve both your life as well as your view of yourself. So what treatments do is they introduce what's called a healing myth. It's an alternative way of thinking about your problems that's generally less critical and more constructive. So for example, if you think about borderline personality disorder as a problem of having very unmanageable moods, you can focus on regulating your mood. Alternatively, if you think about it in terms of your interpersonal hypersensitivity, you can work on stabilizing your relationships. Either way, these ways of thinking about your problems of BPD help you organize yourself to approach life differently. And when you do this, you have an expectation that develops that you can change. And then there's hope. This leads people to be able to more independently cope in life. It seems to be true that the more you do this successfully, even though you'll have your bad days, the more you'll believe that you're capable of being in the world. So at the end of the day, by changing your story about why things happen, you can change your behavior. And that will help you to feel more part of things in the world of others. And that can relieve your loneliness. When we think about treatments that are designed specifically for borderline personality disorder, there are also common features or common ways of thinking about the problem. Remember when we talked about the causes of borderline personality disorder? We discussed how biological vulnerability plus environmental stress combine to produce BPD symptoms. Now, in treatments for borderline personality disorder, we aim first to manage the things that cause patients to be more symptomatic. So you can focus in a number of ways on reducing your mood instability, your behavioral discontrol, and your interpersonal disturbances. When you do this, and then try to engage in life with improving your daily functioning, like we talked about, that can lead you to restart your development in terms of social and emotional skills. The more you live your life and the more you know what works for you, the more confidence you have in managing your emotions and your relationships. The more consistent you are with all of this, the more you can repair your fragmented sense of self. You can generally improve your identity stability by doing things in a way that are predictable to you and to others. And this can help the way that other people interact with you. At the end of the day, these treatments help you feel more consistent, coherent, and connected to others. And that's what you really need to know to navigate any effective treatment for borderline personality disorder. Next, we'll talk about a few different treatment strategies and what we know about the evidence that either prove or don't prove their effectiveness. I'll see you soon at the next conversation.